So today we are learning from Dr. Columbus Batiste in the risk factors and what you can do about it, which is
The
the
Lillian
antidote.
McDermott Show.
So fasten your seatbelts. We're going to learn and grow together. Here we go. Time to dance, Dr. Batiste.
We make mistakes, then we live and learn. When life gets tough and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be. I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friend. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are new to the Lillian McDermott radio show, it is no accident you stumbled upon the show. So tune in because what we do here is we learn and grow together. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life so that you, my listening friend, will feel empowered to learn a new truth and embrace the life of your dreams. Now, today, if you have any questions and you want to add to the topic, or maybe you've been diagnosed with a cardiac disease or an issue that is affecting your heart health, then you're in luck because we have an incredible young man who is going to guide us through this process. And if you are at risk of cardiac disease, heart disease, I don't even know if it's called cardiac disease. I'll get that from the expert. But if you're not at risk, then congratulations. Good job. But if by chance you're listening to me today and you have been told that you have high blood pressure, that you are, have a risk of heart attack, diabetes, you name it. If you've been told or diagnosed with that, listen up because this show could potentially save your life. Unfortunately, whoever is saying yes to this, unfortunately, you're committing a slow suicide. And it's just about becoming aware of what you can do to change it. What are the risk factors? Because someone that's listening today could be a cheeseburger away from a heart attack. So today is your lucky day because we're going to learn what we can do to reverse and prevent heart disease with not only Dr. Columbus Batiste. What am I thinking? Cardiologist Columbus Batiste. I know a Carlos Columbus. And but today we are going to learn from the Healthy Heart Doctor, not just a heart doctor, a healthy heart doctor. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Columbus Batiste is here to do just that. Welcome, Dr. Batiste, to the Lillian McDermott Radio Show.
Happy New Year. How are you?
Oh, I'm doing great. Happy New Year to you. So today we're going to talk about risk factors and what we can do, the antidote. We hold the power to heal ourselves. So Dr. Batiste, you're traditionally trained. How did you discover food as medicine?
Wow. That's a great question. You know, it was a slow process kind of beginning on early in that, you know, every single time I see a patient in clinic, they say, "Hey, doc, what should I do? What should I eat?" And I realized quickly I actually had no training in terms of that.
Wow.
And, you know, as I've mentioned before, things kind of culminated personally in my life when my father passed away from really the complications of diabetes. And it kind of sent me into this swirl of self-reflection and trying to figure out, what didn't I do? What could I have done differently in order to have impacted his life? And what am I not doing to impact others' lives? And so that's what really started my journey down the research avenue as far as for myself, delving into the causes and also the treatment beyond pharmaceuticals and beyond actually looking at procedures in order to treat patients.
Yes, and many people believe that because they've had a procedure, now they've got a new lease in life to go back and do exactly what they were doing that got them sick in the first place. What would be your number one warning to people that have that mindset? What would you say to them?
Stop. Don't believe it. It absolutely is false. It is not a cure, and it is the Band-Aid. And so until we actually stop the underlying process, you will be back again. That's the key. That's the key.
Very good. Very good to know. For those of you who know, I'm obsessed with the documentary Eating You Alive. This is where I met Dr. Carlos Batiste. The first time I learned about him was in the documentary Eating You Alive, and I've got a copy here, and I'm looking forward to the release date. That's going to be nationwide pretty soon. They're going to be rewriting a couple of things before airing it, and I am excited that you'll get to meet Dr. Columbus Batiste, who I am so thrilled whenever a doctor comes on the air, on the show, in the Lillian McDermott radio show, that has gone beyond their traditional education to learn a new truth that can truly support the patient. First, do no harm. So does Dr. Columbus Batiste. And we're going to continue our conversation worldwide at whenyounneedafriend.com. We'll be right here waiting for you. Okay, this is where we get to dance. Whoa, that was a tough entrance. So did you hear about what they're doing?
I did. So Marilee,
yeah. Here we go.
Need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
And welcome back to the McDermott Radio Show, where we always learn from one another. We grow together. And today's teacher is Dr. Columbus Batiste. He is not only a cardiologist, he is Healthy Heart Doctor Cardiologist, Dr. Columbus Batiste. He was featured in the documentary Eating You Alive. And from the moment I heard him speak, you know how they say, he had me at hello. And because it's so wonderful to see a doctor that is traditionally trained go beyond what he knows is truth and find a new truth, which is that food cannot do what a pill can do. By far, there's no results. Share a little bit more about that philosophy, Dr. Batiste.
You know, the one thing I found as far as in my journey as far as practice of patients is that stress is a major component, okay, as far as in the development of disease and the progression of it. Mm-hmm. And what I observed is that I began to slowly see more and more evidence of this stressors contributing to the disease manifestation. You know, nearly 80% of our office visits are due to stress. And so it made me start thinking, when I married that with the issues of lifestyle and nutrition, in my mind, it came up with a simple health equation. That our health is equal to our resilience over our stress. And that the things that we do in terms of our nutrition either add to our resilience or they add to our stress through oxidative stress and some other aspects that propagate the disease process. Now, those resilience aspects are also aided, it's not solely nutrition, but through our social interactions, through our sleep, our rest, through all of those things that come into play that help maintain a healthful state and allow us to combat. Mm-hmm. So our nutrition is vitally important. And in this journey here, I've seen it time and time again play out to this degree.
Yes. But here's the thing. This is the big lie, that if we have a heart condition or some form of issue that is related to our heart, that if we have a stent, a valve, if we have anything put on there, that all of a sudden I can go back to eating what I was eating before. And so I see you nodding your head and shaking your head because I'm sure you get that every day.
Absolutely. I mean, it breaks my heart, I'll tell you. I'm actually in preparing to do procedures today, and so there's a role and a place to do procedures. However, here's the issue, is the fact that there's been cases where I've seen patients after a stent is placed in the setting of a heart attack that their family brings in burgers and fries and milkshakes for the patients to eat, essentially fueling the fire of them coming right back again and having another event. And so as I saw that in my practice, I made a point. I'm that guy. I'm that guy who's telling every single patient every time I'm giving them information about their nutrition. I will pause and take them off the table, and we'll say, listen, we need to have a conversation. Our treatments are either to help you feel better or help you live longer. The vast majority of cases, placing stents are not helping you live longer. And from a standpoint of helping you feel better, we know we can accomplish this through nutrition. We know we can help you live longer through nutrition. We also know that through nutrition, we can offset the other chronic disease burden that's leading to the toll of death in the United States.
Yeah. Okay. So let's do a for instance. Unless you're an active having a heart attack at this moment, when can someone choose not to do a procedure or kind of therapy? Can you try to do, when is it too late to opt for nutritional medicine?
That's a great question. And so in terms of cardiology, it's almost like a spectrum. You can think of it in terms of a storm. You know, you have bright sunny days, then you have overcast, then you have a light drizzle, then you have a little bit of rain, then you have a torrential rain, then you have a hurricane, right? That's natural disaster. So the natural disaster is a massive heart attack, cardiac arrest that we have to intervene upon. When you get into the throes of the rain that's there, that's when there's a level of concern that death can be on the horizon. And that's a lot of times when you likely need to have something done.
Sure.
When you're in the throes of having a little cloudy skies, there, maybe a little light drizzle, that's when we can intervene nutritionally and via lifestyle. So outside the setting of when you're coming in with a precursor of a heart attack, a small heart attack, or a massive heart attack, we can give pause and say, you know what, let's go ahead and let's proceed nutritionally. Now, the big caveat is that from doc's standpoint, their comfort level is, even if they believe in nutrition, they aren't sure if they can trust you as a patient. And so they're going to be inclined to say, well, the only thing I can trust is giving you this prescription, which will save me from you getting upset if something bad happens and saying, well, why didn't you give this to me? They can track and see if you refill your meds, but it's hard to see where you're at on the stages of change. Are you in a pre-contemplative stage? Are you in a contemplative stage? Are you in a preparation? Where are you at? Are you in the action stage, or are you in the relapse or maintenance? And so if you relapse eating healthfully, then it poses a risk to you. So what I preach to patients is, I push for you to embrace you taking control of your life. You going to the real treatment, the true cause and treatment, rather, to reverse the disease, is at your fingertips, because the medications will not do it. They will help a little bit, just a small bit, but not much at all. And the risk is high by taking them.
Okay. So, today I want to talk about risk factors and their antidotes. So an antidote would be, what can I do, to make sure that it doesn't progress along? So I'm sure that you've seen lots of people with high blood pressure, and you've sat them down. What percentage actually listens to you and decides not to take a statin? Or is a statin for cholesterol or for blood pressure?
That's for cholesterol, yes.
Okay, so let's take blood pressure, cholesterol, the medications that you would take for that versus changing their lifestyle. So let's compare and contrast. Someone who says, "Give me the pill, doc."
Yeah, no, absolutely. So those great questions. I'm going to try and hit this real quickly. The risk factors, number one, are being alive. Then we look at, just like you mentioned, high blood pressure, high cholesterol, diabetes, smoking, being inactive, and obviously poor nutrition.
Mm-hmm.
Those are what we call modifiable or changeable issues that are there. And now when I talk with the patient about the options of treatment, I'll be honest, when I started down this road, I said, if one patient says to me, "Hey, doc, I'm in, I'm all in," I take it, I'll accept it. So I would probably guess that maybe about 10 to 15% take me seriously and they go hardcore. I probably have another 15% who agree, they do the nod, and they say, they nod yes, and they say no in their heart. and they will half-heartedly do it. And they may see a little bit of success. I'll have others who will listen and say, yes, I should, but they won't do it at all. So, I'm pleased and I'm overjoyed when anyone tells me that they're willing to go ahead and proceed with the lifestyle modification in order to change their life. I just saw someone yesterday, and we went through the same sequence. Young man, age 46, had significant coronary artery disease. Prior stents that closed down at that young age were really the traditional options looking at surgery, but it was not something emergent. And so I said to him, we can consider going lifestyle. Now, this is a man who's highly stressed, who smokes, a horrible lifestyle. And he said, "Doc, I'll take it. I'll do it." I saw him back in my clinic. Not astronomical changes, but changes. He started making changes, moving towards the lifestyle. He's dropped 20 pounds.
Wow.
He's starting to stop smoking. He's feeling better. He's not where he needs to be, but he's moving. He said, "Well, doc, what do you think? Can I continue down this road, or should I go with the bypass surgery?" And I said, "Listen, you're doing well." I said, "You can do this. The power is in your hands. You can choose to do this, and that we're going to implement what I characterize as a seesaw method." So yes, although he may be on medications right now, my goal is, as he increases his lifestyle, I'm going to eliminate those medications in him for his particular situation. And that's the goal.
Do you do anything special when you're able to take somebody off of their medication? I mean, have you thought of doing something like a little balloon or something that like a happy birthday type of celebration?
I have actually thought about that, actually putting up a picture and featuring them. Now, I lecture every month to do two. I do a cooking class, and I do an actual lecture to the patients in the hospital on whole food plant-based nutrition and stress reduction and so forth. And I usually will feature those patients and tell their story. And right now, that's really where I've revolved around acknowledging them. But I would actually like to kind of put like a success board, like a vision board, but for patients to see, listen, this can be your success. This can be your story. This is not all smoke and mirrors. This is real life.
Yeah. Well, you said, I just realized, as you said, whole food plant-based, we really have not even talked about the nutrition. Let's go briefly, because we do a lot of shows with whole food plant-based. As you know, Dr. Joel Furman is a regular on my show once a month. He's on for the last 2 years. And so we talk about whole food plant-based, but for people who are tuning in today, Dr. Columbus Batiste, heart healthy doctor, I call you so many different names, but the important part is that you have taken the step outside of your wonderful education to educate the people that you hold so dear, that you decided to go to school for and to help. You go beyond what you learned. So let's talk about a whole food plant-based diet. Many people think it tastes bland. I mean, nothing can taste better than a bacon double cheeseburger, can it?
Well, I'm going to tell you this. I tell everyone the same thing. When they first had coffee, did they love the taste? When they first tasted alcohol, did they love the taste? 99.9% tell me absolutely not. They loved the way it made them feel, gave them energy, gave them a spark, made them relax, made them mellow. The food will give you that energy. It will make you feel better. It's lowering the blood pressure, giving you that energy that as you begin down that road, that now you're inspired to eat more and more of it. And so, yes, your taste buds are going to shift, just like they shift throughout your life. But that's understandable and that's acceptable there. I think the key thing is that plant-based, whole food plant-based equals vegetarian. Whole food plant-based equals vegan, but vegan doesn't always equal whole food plant-based. Vegetarian does not always equal whole food plant-based. The difference is eating foods in their closer to their natural state that actually feed the body and provide nutrients.
Love it. Okay, so with that in mind, when we come back, I want to discuss the different things that we can do. Like, for example, the belief system that we have, that because my parents have a heart condition, I am destined to have a heart condition. When we return with Dr. Columbus Batiste worldwide at whenyouneedafriend.com, we'll be right here waiting for you. What a great story. I love that story. I'd love to hear more.
Is the lighting okay? Is the light set up
fine.
on that?
It's fine. It's fine. Yeah, it turned off. The lights turned off.
I'll be right here waiting for you.
I love your quick explanation of whole food plant-based, because we talk about this all the time on the show. No, that was quick, precise. And, I once had a vegan tell me that they hate vegetables. And I'm like, you're what? And they said, well, I'm vegan because I want to protect the dignity of animals. And I said, okay, well, you can do that. But how can you consider yourself vegan if you're not eating vegetables? So some people think that they're vegan if they have potato chips, Coke, and Oreo cookies. So that's not the kind of vegan we're talking about.
Well, what's interesting is most of those individuals would not feed their animals bad food. They would not feed them anything that would cause them detriment. But then yet they're willing to feed themselves things that would cause them harm.
Well,
it doesn't make sense.
Yeah, it's the same people that Dr. Batiste that would not put sand in their gas tank.
Absolutely.
But yet they put toxins in their body as well. So, it's a mindset that we need to change. And it's a way that we can all be part of that awareness to saying, what is it that I'm doing? Now, when we come back from the break, I'd love to talk about, the family history and how that is a belief that we have, that because our family had it, somehow it's going to happen to us too. And so I know that we're ready to go back. Before we go back, just want to let you know that I will go through my social media and I'll
When you need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
Welcome back to the McDermott Radio Show, where we always learn and grow with one another. Today's teacher is Dr. Columbus Batiste. He is our heart healthy doc, and we're talking about our heart, our cardiac health. And if you are I call it a double bacon cheeseburger away from having a heart attack, or you're not feeling well, you've received a diagnosis, listen up, because we're going to give you the tools that you need to never diet again and to never worry about your health again, because you're going to embrace a different lifestyle. It's a new year, a new truth, and a new you. So I hope that you listen up today and take lots of notes, because Dr. Columbus Batiste isn't just a cardiologist. He has gone beyond his training and has learned a new truth about nutritional medicine. And so today I want to encourage you to go to whenyouneedafriend.com. If you need support in any way, this is where you get that support. In a world full of a bajillion friends on Facebook, social media, you have a friend to turn to when you're in need. I'll give you every aspect of all of me here on the show. You can go to whenyounneedafriend.com. Please become a subscriber. When you do that, please confirm your subscription. You'll get an email when you do that. Also, when you become a subscriber, you'll get a copy of the show, so you'll be able to listen to all the shows at your own leisure as well, especially when we have doctors like Dr. Columbus Batiste that brings a lot of information. You may want to listen to the show over and over again until you adopt this into your life. And so I want to encourage you to go to whenyounneedafriend.com, become a subscriber, get lots of free gifts. And also, I want to ask you to please check out my sponsors. Without my sponsors, this show would not happen. So please go to whenyounneedafriend.com and check out my social media, my podcast, my YouTube channel. There's so many different ways we can stay connected. And last but not least, if you have any questions today, you can call 407-373-5959, or you can text me at 407-373-5959. If you don't get an answer today on the show, I will get in touch with Dr. Batiste, and he will, I'm sure, give us a wonderful answer. So before we went on the break, Dr. Batiste, why don't you share a little bit about your background and what school you went to and how long you've been a physician, a surgeon, so that people know that you know what you're talking about.
All right. Yeah. Well, first I want to say, you know what? I so love and appreciate what you're doing.
Thank you.
Because without a change of community, it's hard to move forward, to revive and get one's health back. So I love the fact that you're creating this community of change. And that's so vitally important. And so I'm happy to be a part of it. But as for me, I graduated from medical school in 1998 from Loma Linda University. And I've been in practice since 2004 now. So I am an interventional cardiologist, which means I was trained to put in stents and do pacemakers and things of that nature. And many of my colleagues are doing the valve replacements and so forth. So I've had a wealth of experience and good and treating patients. I've had leadership opportunities and being the chief of the department for about 9 years now. And I serve on the board for the American Heart Association for the local chapter in the area in which I reside. So that's some of the things. But here's the thing. None of those things matter. What matters is that your provider cares about you. Mm-hmm. What matters is that your provider listens to you, right? That listening is key. Because here's the thing is that we know that when we look at studies and placebo-controlled randomized studies, the placebo group gets better. There's a belief that comes in place. Mm-hmm. And there's power in lifestyle. There's power in the mind that we don't really get trained on in terms of traditional medicine. Mm-hmm. And I'll be honest with you, I've actually moved away from calling this an alternative approach to calling it the approach to health.
I love it. Yeah, it's preventative, and it's we watch sporting games, and there's the defense, there's the offense. We want to make sure that we're on top of things, that this is progressive, that this is innovative, creative, and and we don't even have to call it anything other than, we don't have to reinvent the wheel. There's people ahead of us. Even before a stent was created, we ate like this.
Yes,
and
absolutely.
There are many places in the world that don't experience heart attacks and all the different things, because let's talk about the symptoms of heart disease, the symptoms of coronary disease. What could that first symptom be?
Death.
That's right.
Death. Just straight death. And here's the thing. You think of it from this logical mindset. We know that heart disease the beginning of it occurs before the age of 10, before there's symptoms. We know that there's individuals who died from automobile accidents or inside of warfare who've been found to have 70, 80, 90%. We know that there are studies that show that despite what appears to be common sense, most heart attacks happen from areas of narrowing that are 10%, 20, 30, 40% that would never show up on a stress test. that even during an angiogram, we would not place stents, we would not do anything about. That's the vast majority of our heart attacks occur from those areas. And then now we know that a number one presentation is that of sudden death. So it begins in youth, childhood. We know it rapidly progresses and that it can erupt. So when one says, oh, I'm not at risk, yes, you are at risk.
Mm-hmm.
By being alive, you're at risk. Now, the question is, how do you continually add it to that risk of being alive throughout your life, through your lifestyle? That now, as a result of one's lifestyle, and in some cases, it's not solely that now you've developed all of the accomplices of heart disease and diabetes and high blood pressure, and your weight expanding and your inactivity and sedentary state. And now as the stress rises and your nutrition just downward spirals, that you wonder, why is this happening to me?
Yeah.
So from a genetic standpoint, we sit here and we say, well, it's my parents. Well, what we know is a lot of times what your parents pass on to you, most important through inheritance,
Food.
is your nutritional pattern.
It's their recipes.
It's your lifestyle.
It's the family recipes. That's our inheritance.
Right.
Yeah, that trumps our DNA. So that is absolutely true. And I am just so excited to hear you talk like that. You know, and here's the thing, no offense to doctors. Many doctors die of heart attacks. Many doctors are addicted because they're stressed. They don't know how to deal with emotional issues. So we go to our doctors who are dealing with the same things that we're dealing with, and we're getting advice. It's just like getting dating advice from Jack the Ripper. It doesn't work out very well. And I hate to be so graphic, but we've got to empower ourselves and take that back. You're absolutely right. Our DNA does not play as much as a trump as it does our nutrition, those family recipes that we inherit. So let's talk about water. I know that you've given me a series of things that you do want to talk about, and let's talk about hydration. How important is hydration when it comes to being heart smart?
Yeah, hydration, that's a great point. And I wanted to bring that out because our hydration oftentimes now in this vicious cycle of stress and lack of sleep, it revolves around caffeinated beverages.
Yes.
That caffeinated beverages then cause us to pee, basically, and to poop. And so when we urinate, we're excreting free water. That's further cycling our dehydration, right? So now it also is whipping our heart to go faster from that caffeinated beverages. So then we wonder, well, why am I having these skip beats? Why am I having this ache in my heart? And so when we looked at things like the Adventist Health Study, there's not massive studies around water in a role from a heart standpoint. But we've seen in some observational studies that in individuals who ingest 8+ glasses of water, that they have better outcomes, lower incidence of heart-related deaths that are there. And so I encourage folks on a regular routine basis, especially those who suffer with irregular heartbeats, to make sure that they're ingesting water, free water, as opposed to ingesting just caffeinated beverages and juice, which is going to propagate as far as the metabolic profile that's not ideal in their body.
Yeah. And, you know, earlier we talked about, you had said something about the food that we eat, putting sand in our gas tank, right? We know not to do that. And there was another example that you gave that just like flew out of my brain right now. But those are the things that would never do to our car, would never do, but yet we are doing things to us that are unimaginable. One of those things is the dehydration. And here's was a tip that I was given a long time ago. If you wouldn't wash your car with it, don't drink it.
Yeah, absolutely. That's a wonderful one. That's a wonderful analogy. Absolutely.
Yeah, go ahead.
Yeah, the lack of water in our hydration, day after day in clinic, when I talk to folks, I ask how much water have they had, and they tell me that they maybe have about 8 ounces a day, and you wonder why. It's problematic.
Yeah, and we're doing it to ourselves. It's like slow suicide. We don't even know. We're playing Russian roulette with our health. And we're going to continue our conversation with Dr. Columbus Batiste, Healthy Heart Doctor, when we return worldwide at whenyouneedafriend.com. We'll be right here waiting for you. I get so excited when I talk to you about these things. There's not that many doctors out there that would risk their, I don't know, diploma, their education. They can be stripped from it because of what you're saying. Are you ever afraid that they might take away your credentials because of how you believe?
Well, here's the interesting thing, is that when we look at most of the major societies, the first recommendation is that of lifestyle. But the problem is that physicians are ill-equipped in order to give a prescription for lifestyle. So what we do is we will go ahead and we hand that off to a dietitian or to a health educator, and we bypass that. And because of the time constraints, we write a prescription quickly. And so this is actually consistent with guidelines, but it's not embraced in practice. So I'm never worried about a standpoint of being having my license taken away or revoked because I am promoting a lifestyle venture. You know, what I found, I was extremely afraid of this when I started out. I thought that people were going to look and say, oh man, he's a quack.
Yeah.
And when I finally decided that this is something I have to do, as I reflected on, like I said, I always go back to the experience with my dad and a few other patients, it was masterful. In the timing, it was what I knew I had to do because the first several patients had phenomenal outcomes.
Mm.
And now, fast forward about nearly 9 years since I started this,
Wow.
I have other individuals in my department talking about whole food plant-based, talking about dietary practices. They refer patients to the cooking class. I brought in a dietitian into our office. And here's the catch. This past year, our medical group asked me to give a talk to the doctors on nutritional medicine, nutritional resilience.
Good for you.
I gave a talk to hundreds of docs about nutrition, and they started texting me afterwards saying, hey, Columbus, I want to eat better or whatever else. Here's what I ate today. Hey, do you have any information about this a little bit more? I want to kind of learn about it. I gave about a 20-minute talk, and so it was really encouraging. And some of the administrators, they're saying, you know what, I've gone whole food plant-based, and I feel great.
Mm-hmm.
And so the tide has changed. The time is now, the iron is hot, that we have to push the envelope forward to educate physicians. The reason why physicians don't do this is because they're not educated inside this, and that's not fair. And they need to be provided with education about nutritional benefits.
Wow. You know, it makes my heart smile when I hear it. Because when I first started the show, Dr. Batiste, it was all about being a compliant patient, to learning, listening and trusting your doctor and doing exactly what they tell you to do. And somewhere along the way, someone challenged me to eat raw vegan for a month. And I didn't even know I didn't know I could feel better. I wasn't feeling bad. But since then, in this journey, I gave up all my asthma medication. Look at what I gave up. I gave up my asthma medication. Talk about the mindset. And I gave up all my, just the meats that were, I couldn't digest them. And so, I don't consider myself vegan anymore. I don't consider myself vegetarian anymore. I gave up dairy a long time ago. But what I do, I follow nutritarian lifestyle. But here's the thing. It's so addictive that one bite of a chip, you got to eat the whole bag.
Absolutely.
What are your tips? What are your tips to staying focused on this lifestyle?
That's such a huge question. And I go back to, I think you have to have support. I think you have to have support in creating a network of individuals around you who can encourage you. I mean, I'll tell you, I went out to eat with my sister for her birthday yesterday. And so she's very knowledgeable in all of this, but she struggled like everyone else back and forth with the addiction. And so she had started off really well. I got there a little bit late and was having oil-free, salt-free vegetables for our birthday celebration. And then someone there had some nachos, and she's looking, that was one of her weaknesses.
Oh.
Was the nachos. And so I'm always characterized as the food police. But as I sat there with her and we're chatting, and she grabbed the nacho. I didn't say anything at first. She grabbed one. But then when she went back for another one, I looked at her and I wagged my finger. And I said, no. And she saw me and she put it down and said, thank you. She said, thank you. She said, I needed that because I'm not hungry. It was just a mindless eating venture. And that one taste, that one lick, and people wonder, well, why am I not making progress? Because you don't account for that one piece, that one taste that then leads you to more, and you don't count that as a meal, and it spirals and it propagates, and it leads to this downward cycle of saying, what is my real purpose and my goal by eating healthfully? Why am I choosing, as you said, to put the recommended premium unleaded gas inside my tank as opposed to diesel or unleaded or corn oil because it's cheaper? Because I want that car to run longer. I want that car to run better. I want it to be efficient. I want to prevent it from breaking down. And I expect that if I put the wrong fuel in it, it's going to break down. And so that's the same sort of concept we have to look at, going back to what is that carrot in front of us? Is it weight loss? Is it getting off of the medications? Is it staving off meeting a new doctor every several months as I go in through the ER and for procedures? Is it so I can take care of my grandkids and my kids and my loved ones and be there for them? And visualizing that goal every single day is the thing that can keep you on track, because you have to know yourself. I'm all or none. I can't have any of that stuff because I'm going to eat the whole bag.
I know.
I'm going to drink the whole. Yeah.
I'm going to drink the whole bottle of wine. I'm going to drink I'm going to eat the whole chips. I'm going to have the whole and not only have a burger, but have a double, triple, quadruple bacon cheeseburger. They've got so many different ways to addict us. And what we don't know is that the food industry spends billions of dollars hooking us. And I bet you someday there's going to be a class action suit by someone who's morbidly obese saying, just like cigarettes had nicotine to cause addiction, food should be at that same level, because we think like addicts, we act like addicts, and we behave like, we follow through and it completely dulls us. It numbs us. And let me tell you, just recently, I said to my husband, going into the new year, I said, you know what? These chips, I don't know how they get here, but I was eating them. And I said, starting January 1st, we are committing to a whole food plant-based lifestyle. And it's been great. And so yesterday he says, we've been 10 days. It's been 10 days. And because it's like no alcohol, and it's not that I'm giving up alcohol. It's I drink in moderation. I don't have any addictions other than sugar. Sugar would have been my only addiction, and that's a huge one because that leads to a lot of things. So let's talk about that. That's a great one when we go back, because we're about to go back on. Is when we eat this way, we crave food.
Need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
Welcome back to McDermott Radio, where we always learn from one another. And today we have Healthy Heart Doc. I just love him. Dr. Columbus Batiste is on the Lillian McDermott Radio Show. This time has flown too fast, and it was too long. It's been too long since you've been on the show. We got to change that. There are a couple of things that I do want to talk about. I want to talk about exercise. I want to talk about meditation and prayer. These are two things that are very important to you as well. I wanted to add, because you and I were talking during the break about chips and the foods that cause addiction. Pringles was blatant about the addiction. You can't just eat one. You got to eat the whole pack. And so what I've noticed is when we eat these foods that cause us to be addicted, just with the first bite, we make poor choices. That salt, that sugar, that combination makes me want to eat more, makes me want to drink more, makes me want to, hide and do things that I really don't want to do. So what is a good tip for someone who really wants to stay focused? What would you say to someone who really wants to do this, the 10 to 15% that really wants to do this, but because they grew up in a Spanish or Italian or an ethnic home of whatever that promotes eating, this happened to me, promotes eating a certain way. When you walk away from it, you might as well walk away from your religion, because you get sabotaged left and right, ridiculed left and right, but they'll return to it. Don't worry. So what would be your advice?
I'm going to tell you this example. So a year ago, we did this challenge here at the hospital with a group of staff. And one of the staff members, he embraced it wholeheartedly. And he made a complete commitment towards a whole food plant-based diet. And since his blood pressure normalized, diabetes normalized, lost about 60 pounds, and he's still doing well, but he doesn't have the support of his family. His family continually tries to sabotage him by giving him meat or giving other things that he has to, like, no, I'm not eating that. And but he's had the wherewithal to kind of continue on, and the support from the small group here to push him forward. But when I look at what can you do to offset it, I always tell folks, focus mostly on what you are eating as opposed to what you're not eating.
Yeah.
Focus on filling your body up with those good things, and now you're less tempted because you're full. Mm-hmm. I told someone one time, I said, before every meal, you're having a large salad, you're having a pound of greens, you're having all these things and water. And they said, but doc, I'm not going to be able to eat the other stuff. And I looked at them and I kind of winked. And they said, I got you. And that's the key thing, not allowing yourself to get famished and hungry. Because when you're at your moment of weakness, is going to be under the periods of heightened stress. The end of the day, after you made decision after decision, and you mentioned about the reason why I brought up meditation or prayer is because that's been shown to be powerful in terms of looking at one's willpower. Mm-hmm. Increasing that prefrontal cortex decision-making and giving you the fortitude in order to make these decisions. Mm-hmm. Because it's important, it's a mix. Making a decision is not enough. It's also, what's my approach? What's my transition? Do I have the decision-making process that I'm not going to fall back on that inner child, that amygdala, and I'm going to make these rash decisions because I'm starved. Mm-hmm. I'm going to the grocery store hungry. I'm looking at every fast food joint going by because I'm famished. I'm thinking of that bacon cheeseburger or the triple layered cheese pizza or whatever it may be, whatever your thing may be. But instead, if I'm full because I planned. So planning is the key, right? I plan for every situation. I plan for my weak moments. I plan for when am I going to be, when I'm tired after a long day and I'm working on the kids' homework and I am at the end of a long work day and I'm famished and I'm going to eat that whatever, how will I keep myself from doing it? What's my plan going to be? I want to plan for those worst case scenarios that I can have myself situated so it doesn't happen.
Well, this plays right into the theme of the Lillian McDermott radio show this year. The theme of the Lillian McDermott radio show this year is a new year, a new truth, a new you. And we're doing a series with some of the folks from Eating You Alive. We're doing a series of setting ourselves up for success. If you have something in the refrigerator that's already, we're talking about batch cooking, we're talking about recipes that are easy to make, like within 5 minutes, boom, you've got everything ready. When you do batch cooking, you got everything there that you need so you're not tempted. So some of those things that we're talking about, and you're absolutely right, Dr. Batiste, we have got to set up our mindset to, and by the way, that man that released the 60 pounds, let him know that I was ridiculed too. I hated going to family dinner parties because, eventually somebody would make fun of me about the way I was eating. But 20 years later, because my whole food plant-based transition didn't happen overnight. It happens with 20 years coming. And every time I do something or I give up something, was made fun of. But the same people that were making fun of me for the last 20 some years are now gluten-free, are now not eating meat, are now eating like I eat 20 years ago. So sweet revenge. And when I say sweet revenge, it's because you know that how your behavior has affected somebody else to raise them up. And now you can be there for them when somebody wasn't there for you. So
Absolutely.
Meditation, I love the meditation and how that keeps you focused on what you want. And exercise, how much exercise should we do?
Exercise, basically, you want to exercise moderately is the biggest thing. There's been back and forth, high intensity workouts are good, but the key thing is that we know that extreme workouts still propagate an oxidative stress in your system. So my key thing is that NEAT, that non-exercise activity thermogenesis is important. That means the standing up, walking around. That means that, hey, when I'm on the phone, I'm walking around. That I'm on my feet more than I'm on my bum. That I'm so using the apps, using whatever that's going to trigger you to stay up and around. We know that burns calories. We know that that's consistent with improved outcomes. And that was the genesis for all of these smart devices, the watch and the phones that now have these apps that help encourage you to move. And that's really what it's about, right? We live such sedentary lives, but if you think back on the dawn of time, people didn't exercise, but guess what they had to do? They're out there gardening. They had to walk where they were going.
They had to chase after their animals. They had to chase after their meals.
Absolutely. So we kind of have to get ourselves back to that by moving more. And if you notice that you're not moving more, what I tell folks is that you look at whatever device, your pedometer, if you notice that it has 500, 5,000, 2,000 steps, then you know you need to get out there and do some more. Yeah. You need to get it up over 10,000 and let that be your guide for being an active individual and make it fun. Exercise seems like it's a punishment. Do something that's fun that allows you to socially connect with others. If it's dancing, if it's playing a sport, if it's walking, if it's going store gazing, walking in the malls, just to kind of get active is important.
Yeah, find a new passion. You know, we can replace just about everything that we want to. Bad habits can be replaced with good habits. Don't replace a bad habit with another bad habit. So here's the thing: we can go to meetups. We gotta create a new tribe, basically. Find a new friend, and hopefully the show will be able to support you, my listening friend, as Dr. Columbus Batiste has supported us today. Thank you, Dr. Batiste. This has been a wonderful conversation. A final word for someone who believes they cannot reverse their diagnosis. What do you say to them about reversing diagnosis naturally with nutrition?
Be resilient. You can. Resiliency is that bounce back. It's the ability to recover. And you can be resilient and fight the stressors that lead to chronic disease. You can reverse your heart disease. And when I say reverse heart disease, you can stave off symptoms. You can stave off recurrent heart attacks. You can stave off death from cardiovascular events. In my mind, that's reversal of heart disease. It doesn't matter what the arteries look like. It matters how you feel and how your longevity is.
Wonderful.
Believe it.
I am so excited. Thank you so much. I want to say a big amen, brother. I think this is wonderful. Thank you so much. And to you, my listening friend, take your health back. You can do it. I believe in you. And remember, if you need any help or any support, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Dr. Batiste, I know you probably have a ton of things that you need to do. Thank you so much. I know that you had procedures today. Yes. So you have more procedures now?
I do. I have to kind of overlook the lab. It's really what my role is today, and then to just kind of help cover for folks. So I have a little gap in time, but yeah, I'll start to kind of review the patients coming in for today.
Thank you so much.
It's always great speaking with you.
I know. We got to do this sooner than every 5 months. And
yes.
I love what you're doing. I love what you're about. I love the fact that you're passionate. You're absolutely passionate, and that's what makes it a big difference. Anybody can go to a doctor that has no clue. This person that was it today? Anyway, I've had back-to-back things that I've been doing, but I received a picture from someone, and then I coached, even though I do not, I'm not a health coach or a nutritionist. As a life coach, I deal a lot of nutrition, and I deal with a lot of issues that span from childhood that gives us like familiarity with the food. And they sent me a picture of their legs. They were swollen. It was just horrible. And they went to the doctor, and they called me yesterday, and they said they think I have this, they think I have this, they think I have a clot, they think I have it. And I said, stop it. Just stop it. You know what you got. You gotta stop poisoning your body. You got to stop poisoning. Some people hold on to that diagnosis. Oh, I've got heart disease. Now, all I need is a stent.
Yeah. I tell folks, you know what? The only difference between you and me is the fact that, yes, you know it absolutely. I may be uncertain. I may not be aware yet. But we all are dealing with things fighting beneath the surface, what's lying beneath that we have to be diligent with on a recurring basis.
Yes.
So.
Absolutely. I'll let that be the final word. I know you're really busy.
Yeah.
And I thank you. And thank you, my viewers, for staying till the end of the show. And I look forward to our next conversation.
All right. Take